So one of the things we're hearing is that 2 months into the pandemic kind of hitting, a lot of people say they're still seeing outdated, confusing, or contradictory information on the state's unemployment website. Does the state have a plan to fix that?
So where we are on our unemployment filings is we have now processed about 88% of all new claims filed in March and in April. Now those are about 600,000 total filings, the most that we have ever seen in our history, and so getting that 88% done is very important. But what that means is that some remaining claims are a little more challenging. And they're not challenging because of people's circumstances. It's just that unemployment isn't just state, it's also federal law. And so under federal law, if you check a wrong box, if you say that you were fired, or if you say that you're not seeking work, there are multiple ways that simply by filling out the information in a wrong way, federal law doesn't allow us to say yes. And so what we're doing is we're shifting. We've had a whole lot of what we call Tier 1 employees, trying to get those claims that can get processed and done through the system. We're now having to shift to have more employees to go through claims where people just need to change their application to make sure that that box that was checked was in error. Because I know everybody needs help. And while we've helped a record number of people, if you haven't been helped during this time, during this worldwide health pandemic, ultimately that is on us. So we are working hard. We are working fast. We want to provide everybody that help they need. And it's a challenge because of our old system. It's a challenge because we've opened up unemployment to folks that didn't previously qualify and had to on the fly change the system and get people in. But there isn't any excuse or a good excuse if we haven't helped you and you need that help. We're committed to doing it. It's a commitment that some other states out there don't necessarily share, but I made the commitment. I asked people to sign up, and now we've got to honor what we told people we'd do.
Is there a way for your IT team to go and kind of update that old website, that old system to be clearer with folks about different filing rules and stuff? Because it seems that some people are getting tripped up by what they're seeing.
So we're working on that every day. What we had is a system that in the beginning of March was designed to tell people no based on federal law. If you're an independent contractor, the system would tell you no. If you are a small business owner, right, the system may tell you no. If you're a substitute teacher, if you work in a daycare and a church, all that system was designed to do was to use those federal screening tools. And we've had to go in at the same moment that all of a sudden, we've got more claims than ever before and change that system to be able to say yes to all the people out there that need it. So yes, our IT people are working day in and day out. It's building an entire new system during the crisis itself. It's kind of like building an airplane while flying it. But as opposed to that, it's people in need that aren't getting what they need because of that. So while I'm proud of the work our people have done, it hadn't been fast enough, and it's not acceptable if somebody hasn't been helped. And I hope I've been clear throughout this that I'll take responsibility for that. Even in an unprecedented time, it's my job as governor to make sure that we can get this done, and we're going to continue to work to do it.
People are having trouble getting through on the phone lines. Obviously, you guys have a high volume of calls. Is there more the state can or is planning to do to try to communicate with people through social media, things like that, outside of that old website and system to clear up some common questions?
Yes, and what we have found is that we hired a lot more people to answer the phone, but there's a difference between having someone answer the phone and having a quality conversation that helps you. And so what we're trying to do now is we're trying to improve the quality as opposed to just the quantity. And that's been hard because if you finally get through and you've been trying to get through and then you don't feel like you're helped at all, that's some really awful frustration that people shouldn't have to feel. Our goal is for our people to be directly contacting those that have the oldest claims. And we are bringing in another 250 what we call adjudicators. And those are the folks that deal with the most difficult claims. And if they could do, a certain number a day, our hope is that those challenging ones that have lingered, that we can move through them very quickly. I do believe that we're doing better by volume every day. We've gotten to the point where there aren't, big holdups of 30,000 people. Those have all been resolved. We're now down to those challenging issues of does the federal government still say you don't qualify? Was a box checked incorrectly? Those types of things. Is there a problem with the identity verification? And if we can get through all those, then we can hopefully get everybody out there helped.
A reader wrote in saying they were approved for benefits in mid-March, but they still haven't actually received any unemployment checks. Is there a delay that you guys are running into, even for people who have been approved, to actually get that check?
Well, I'd want to look at that one specifically. Typically, we haven't seen a delay. We've actually seen some speed once people finally get approved and when it gets there. Now, there has been some confusion with folks as we've been working when we hear complaints, and we try to respond to those about what they're waiting on. So we had an individual the other day, and they'd written to a local newspaper, and I'd read it, and I'd said, well, we ought to help this person. And as it turns out, they had received their unemployment. But what we're doing as a state is when you qualify for unemployment, we're also making available things like SNAP, which help with purchasing food, trying to get you signed up for Medicaid if you qualify. And for this individual, they were waiting on their SNAP benefits. They had just confused the unemployment with that piece. And so part of what we're also running into is we're trying to provide a lot of help, not just in one area. That every area that you'd qualify for, we want to make sure we can do what we can to help you as a state, make sure that just during this 2 or 3 month period, because our economy is going to get going, this is just a pause, that you have the unemployment that you need, you have the health care you need, you can buy food. Those are all really important things, and providing them all at once in this web sometimes creates confusion, but it also provides more help to people.
Do you know how much money roughly is left in the state's unemployment trust fund? And do you have any estimate on how much money that the state's going to need to borrow from the federal government to keep covering claims as this pandemic continues?
So our commitment is to help everybody who needs it and to help them out for the period of time until we not only restart but reboot our economy. And I'm committed to restarting our economy in a way that works in the long run. Now, the worst thing that we could do right now is restart in a way that causes a spike and makes us shut things down. States that are going to emerge from this with the strongest economies are going to be the ones that do it smartest. And once they open something, they can stay open, and that can build and build and build as we move forward. So what we're going to need is enough money to help people to get through as we do that smart, safe reopening. We believe that we certainly have enough in the fund until the end of spring and, in fact, through summer, at least part of the summer. But like every other state, we are waiting on the federal government for the next CARES Act legislation. No state can get through this crisis without direct budgetary aid. This isn't just me. This is all 50 governors, Democrat and Republican. There is zero politics. It's just basic math. And if we don't get that help, yes, we'll have to borrow more money from the federal government, which I'm willing to do for unemployment. But it's going to cause a lot of other issues as well. And so it's disappointing to see in D.C. the same old kind of back and forth and horse trading going on when this is a time of national crisis where every state and local government in the country needs help to make sure that we can get our economy up and going. And there isn't an economist out there that would disagree with the fact that if you don't help states and counties, you will make this recession longer. So everybody out there that's saying that we want to reopen successfully, well, if they're not helping us up there in Congress, they're not doing what needs to be done to make it happen.
Speaking of reopening, yesterday the country's top infectious disease expert, Dr. Fauci, said that the consequences could be serious if the country reopens prematurely and if states don't adhere to the White House's guidelines. One of those guidelines is to see a 2-week decline in cases or the rate of coronavirus cases. Kentucky hasn't seen that decline yet, but is now starting to reopen economically. Does his comments cause any concern for you that the reopening is potentially dangerous, or give you, I guess, are you going to reconsider your plan in light of his comments yesterday?
Our goal is to reopen Kentucky's economy in a gradual and safe way to ensure that we can get people back to work, but at the same time, we acknowledge we are still in a worldwide health pandemic, the likes of which none of us have ever seen in our lifetime. It's why I believe if you look at Kentucky's plan, it is closer aligned to the White House's reopening plan and to Dr. Fauci's advice than just about any other state that is moving forward with reopening. You'll see it's very gradual, and that is by design to give us time on testing and tracing. Our testing capacity is now significantly higher than it was in the past, with real opportunities to significantly exceed what the White House wants on that side. Additionally, while our number of cases have plateaued, remember we're testing significantly more. So our percentage of positives and the overall number of tests is declining. For instance, our Kroger sites, which test the general public, it's about 1%. Our hospital sites that are going out in areas where folks are sicker is closer to 5%. But what we are seeing is that rate, the rate of positives is low, especially in the general public. So I believe that our plan is safe, tracks closer with that White House reopening plan than most do, and gives us an opportunity. But it's all going to come down to the people of Kentucky. Now, the reason we flatten this curve, the reason we have saved in Kentucky, we have saved tens of thousands of lives is because of you, our citizens, knowing that if we follow those rules that we can protect one another. Same thing is going to be healthy at work, not just protecting lives, but whether or not we can continue to reopen our economy is about keeping a new outbreak of the virus down. Now, what we are going to see as we move forward, though, is perhaps regional outbreaks, which Warren County, Bowling Green is going through right now. So let's remember this thing isn't gone. And even in places that look like they had a low amount, it can significantly increase in a very short period of time. So just because you're in an area that's had a low number of cases doesn't mean that you don't need to follow the rules very, very closely. You know, we only have one shot at reopening the economy the right way and in a safe way. Let's make sure that we get it right.
In terms of reopening, you've stressed contact tracing as a key part of that. Yesterday, I believe you said the state was hiring around 20 people to do contact tracing for the state. In the past, you've talked about hiring several hundred people. Is that a discrepancy, or is it just that most of those hires will happen by local governments rather than the state?
There's going to be three levels of hiring. There's going to be 20 additional people in our Department of Public Health. There's going to be 70 plus regional assistants, and then there's going to be about 400 to 500 folks that are going to help both local health departments and working through the state on doing some of the contact tracing itself. But what's important here isn't necessarily our workforce. It's going to be there to do this, but it's going to be understanding our new normal. So our new normal and being able to reopen and do more things in the midst of a worldwide health pandemic is going to mean that we follow rules, that we voluntarily do smart things like wear masks that keep us from spreading the virus to other people, and then understand that there's likely going to be a time where you're going to have been exposed to someone who is positive. And when somebody calls you and tells you that, you may have to self-quarantine. That's part of our duty. And the only way that we do this safe economic reopening is to be willing to do that. So don't be the COVID positive person that refused to stay home and went to a grocery store multiple times. If we do those types of things, you know, we spread it even faster, and it makes opening our economy that much more challenging. But I feel good where our cases have plateaued. I feel good in our testing capacity increasing every day. I feel good that we're going to get this organization of contact tracers in a very good place, and we'll have some more announcements in the next 4 or 5 days on that. But that doesn't mean I don't worry. That doesn't mean I don't worry. I mean, this is a virus that spreads aggressively and to many people can be deadly. And I've certainly made it my goal, and it's been Kentucky's goal, to do everything we can to protect lives out there. So every day we'll be looking at every decision to make sure that it's the right decision.
Another question we've gotten, I know you've heard about child care facilities having their insurance claims denied for having to shut down due to the pandemic. Is there anything the state can do to make insurance companies pay up to the child care facilities, or is that something that's essentially out of your hands?
Well, I stand with our child care facilities. Just because it's really hard to figure out how to do child care safely in the midst of the coronavirus doesn't mean that those facilities aren't critically important to our families, to our economy, and to getting back to a new normal, and hopefully sometime in the future, more of an old normal. And we have to keep that capacity in place in Kentucky and not have to rebuild it. So these insurance companies should step up and should do the right thing for organizations that serve families all across Kentucky. I'm certainly willing to lend my voice to their cause. I know that they are in litigation right now, which does lessen some of the things that we can do, but I hope all state officials would step up and would do their part to support these facilities. And we hope that we're going to be able to come out with a plan and guidelines to be able to open many of these facilities in mid-June. But I will say in just about every state where they're open, they're doing one of two things. They're like us, and they just have a limited number of facilities for frontline workers, healthcare workers, or they have very limited capacity in specific rooms. And that's what all the public health officials are talking about ability to do it safely. And with a couple of kids that are now suffering from a COVID-related disease or complications, we want to make sure we get this right.
But there's no mechanism at the state level that you know of where the state can require insurance companies to cover these interruption claims?
Well, that's a challenge with it being in litigation right now. But let me say that those facilities have my full support. I appreciate what they do. Again, just because it's been a challenge on child care during COVID-19 doesn't mean that I don't wholeheartedly support what they do. They are great people serving families that desperately need them.
I've got one last question for you, and that's back on unemployment. Can you talk about if there's any kind of common pitfalls that you're seeing people fall into, just to kind of give people a sense of, hey, here's a few key things, try not to, answer wrong and you should be okay?
It's checking boxes that suggest you were laid off or that you quit, especially that you quit. That creates a problem under federal law for you getting unemployment. I think it's really important to read the FAQs because we're not getting caught up as much in somebody being an independent contractor versus a direct employee anymore. What we're getting caught up on are the ways that people are answering the questions. So carefully read that guidance that is up there. Let's make sure that when you need help, it's not simply because we've marked something wrong. And then please check your email and your phone because if you can be available, and I know it's tough, you're calling a ton, but if you can be available when somebody calls to check on identity verification, something we have to do to prevent fraud, it does make it significantly easier. And make sure you have things like your driver's license on you so you can provide that type of information. We've had a couple of instances where folks have gotten called but don't have access to what's needed at the time, which isn't all that significant. But if you have that on you, I'd love for you to be helped in one phone call instead of multiple. But again, to everybody we've helped out there, I'm glad that we were able to the 88% plus of folks. I'm glad that's happened. To everybody else, we're going to continue to work. I'm not going to shy away from it. I'm not going to make excuses. We want to get this done, and we want to make sure that you get the full payments that you are owed going all the way back.
Any last message you have for Kentuckians who are listening and who read the Courier?
Well, to the Kentuckians that are out there, again, we're going to make it through this. This is the challenge of our lifetimes and of our generation. And it wasn't just going to be a 1 or 2 month challenge. Now, the most important part of this, you passed. We had escalating cases in a way to where if we had not responded the way we had, if you hadn't done the jobs you did being healthy at home, we would have overrun our healthcare facilities and we would have lost tens of thousands of more people. You see it in so many other places that weren't able to react as quickly as we did. New Jersey has lost more people to this virus than they did in just about every war the country has ever fought. New York has lost 3, maybe 4 times more people now, plus than they did in 9/11. So what Kentuckians did was so special. And the most important time that we needed them, they were there. Now we transition into a new normal. We knew this adversary would be here, and it's time that we rededicate ourselves to doing what it takes to beat it. Because remember, when we make bad decisions, when we get tired of following those rules, we probably don't suffer. It's the person that we spread it to that suffers. And they may have made every right decision, but they're the one that pays for somebody who's unwilling to do the right thing. This virus ties us together, even when we have to be apart, in ways we could have never imagined, where every individual citizen's decisions can impact so many other people. So let's continue to do the right things. Let's continue to be patriotic Americans and good citizens of Kentucky. And let's encourage all of those around us too as well. But I'm going to close by talking about something that I know some folks kind of struggle with, and it's wearing a mask. Every single healthcare professional now is recommending it. And it's because we're going to be around more people than we have. But I want to talk about why I wear this. It's for 2 reasons. Number one, I couldn't live with myself if I was asymptomatic and I spread this to somebody whose body couldn't handle it and who passed away, knowing that if I'd worn the mask in public, that person would still be around. I want to make sure I'm living my faith and protecting the people around me. Second reason, though, is if everybody wears these, I'm less likely to get it, and my kids are less likely to get it. And the concept that I could bring this home to my kids is something that I want to do everything I can to prevent. So is it fun? No. I mean, is it uncomfortable? Yes. But does it protect the people around you? Absolutely. So again, most all Kentuckians are already doing it before we talked about it. Let's just encourage everybody else to. Collectively, it makes us so much safer. And let's continue to pass this test of humanity and to protect one another. Thank you to Morgan. Thank you to the CJ. Thank you to everybody out there watching.
Thanks, Governor.
Thank you.
And thanks for listening. Bye.